Hi, I'm Mike. I'm a doctor of physical therapy at Current Physical Therapy. We recently got a question from someone asking about what we can do for arthritis in the home. We've had some people that have said that they have recently had some flare-ups because they haven't really been able to get outside, and they've been really stressed lately, and so they're just wondering if we had some ideas for them of what they can do to help reduce the pain that they've been having from arthritis. A lot of people know that arthritis is pretty common. A lot of people experience it. It can be pretty painful based on the flare-ups that they get and other factors. Something that's important to note is just because you have arthritis doesn't mean that you necessarily need to have surgery. If you do your best to keep the joint strong and healthy and keep it as mobile as possible, sometimes surgery can be delayed or altogether avoided. So one thing that is common that we generally have our patients do with arthritis in the shoulder is we'll have them do something called repeated extensions. So you can take a dowel like this, and if you don't have a dowel, you can take a broom handle or something like that, and you'll put your hand on one end and you'll go straight back. Okay, you go as far back as you can without pain, but you're just going as far back as you can, repeatedly, just like that. And you can do that 20 to 30 times, and you want to do this throughout the day. Okay, like I said, we want to get the joint moving as much as we can with as little pain as possible. Okay, so that's option number one. Option number two is something called table slides. So what you can do, there's two different ways you can go. You can do abduction or you can do flexion. The idea with this one is similar to that of the dowel extensions that we just did. We're trying to get the joint to move as much as possible. So what you can do is you can slide your arm out sideways as you're sitting next to your kitchen table or kitchen counter, and you're just sliding it into abduction, which is this motion. And you can do the same thing 20 to 30 times this, and then you can slide forward. Same thing, as far as you can go, 20 to 30 times, just like that. Option number three is more of a stretch. It helps you have a little bit better posture. We're stretching the front of your shoulders here. It's called a corner stretch. So you'll do it just like this. You want your arms at 90 degrees, just like that. Lean in. And you'll hold it for 15 to 30 seconds. And you should feel a stretch in the front of your shoulders in this area. So keep your questions coming. We really appreciate it. If you do have any questions, please comment on the video, or you can even call us here in the clinic. We are open in Nampa and in Fruitland. We're trying to keep our buildings as clean as possible, and we just want to do our best to help our communities stay active and stay healthy. So thank you so much.